Yes, as a matter of fact, it's one of the most common things that women complain about when they come to see me. And they may be coming for other reasons, but they also notice they're having hair loss, or they may be coming to me just because of hair loss. So it's very common. And, you know, it's important. One thing that I always try to do is figure out what they mean by hair loss. Try to figure out how much they've been losing, so to quantify the amount of hair loss. Has it been increasing, or is it just recently started? Those are all important questions because that has an influence on what the underlying root cause may be. We know that we lose, I mean, on average, they say we lose about 100 hairs a day, but that's going to vary a lot. So I always try to reassure women that there may be some times where they're losing a little more hair than they normally do, and sometimes where it slows down. And many times they'll go through cycles where it may pick up for a while, but if it doesn't continue, it may not be a concern at all. We know that may happen depending on the time of month it is. If you're recently going into perimenopause or postmenopausal times, there may be a shift in and an increase in hair loss. And of course, when there's more stress, so if there's a stressful event that occurs, we will often see a significant amount of hair loss. And many times it's 4 weeks or even 3 months after that stressful event occurred. So women don't always put that together. They're saying, I'm losing more hair now, and I always ask them, well, what was going on over the last 3 months? We know that any sort of major surgery, a lot of blood loss, a major infection, a significant change in diet or weight loss or having a baby, all of those things will be associated with an increase in hair loss a few months after that event. So sometimes with hair loss, we give a lot of reassurance and say, okay, let's just watch this over the next few months, because many women will notice that it slows down when those things have shifted or gone away. But I always, because I believe so much in nutrition, I always want to really get to figuring out, could there be anything going on with this person's diet or lifestyle that's really impacting this hair loss, and what can we change from a nutritional standpoint?